Start.
Hello, I'm Dr. Trivedi, a doctor working in this clinic. May I confirm that I'm talking to Ricardo Scamario, 42 years old?
Yes, doctor. It is Ricardo Shamarshia.
Okay, how may I address you?
Please call me Ricardo.
Okay, Mr. Ricardo. Today, I'm going to discuss about your health issues. Will that be all right?
Yes, doctor. I just wanted to talk with you, doctor. I asked one of your nurse to make an arrangement with.
Yes, yes.
Believe I am. I am. It is boring, doctor. I have been
Yes,
admitted in this
yes.
hospital for 3 days.
I came to know about our nurse from my nurse that you have been willing to talk to me. So I'm here. Would you like to discuss the issues with me? Your issues, health issues with me?
Yes, doctor. I have been admitted here for 3 days, and before that, I was weak for a quite long time, more than 1 month. I have visited your hospital several times, and your doctors have arranged a few investigations and several times. But I don't know why they have admitted me here. They are doing nothing for me. My symptoms aren't getting ameliorated, doctor, and I am becoming. I think I am here just for nothing. Why don't you start any treatment? Even anyone didn't talk with me that what is going with me. What are you planning with me?
Yes, yes, Mr. Ricardo, I'm very sorry to hear that you haven't been shared with any ideas, but I am here today now to discuss about it. Will it be okay?
Yes, doctor. I just want to know that why have you kept me admitted into this hospital and didn't arrange me anything for me?
Yes, yes, I can get it. And well, do you have any idea that what can cause this type of raised temperature for a long time? What may be the causes? Do you have any idea?
Doctor, I heard that there might be some cancer or there might be some bug infection that can cause this. But your doctor didn't they considered this before? They tested several times.
Yes, I actually appreciate your concern and I can understand your troubles. Well, let me share with you now that actually this type of raised temperature for quite a long time can be caused by some several conditions. Uh, like as you have said that it can be caused by some cancer, some bug infection, sometimes some inflammation also. Okay, and even sometimes the body's defense system can work against our own body. It's called some autoimmunity. Don't bother about the term. Even it can also sometimes cause this type of raised temperature for a long time. Are you getting me, Mr. Ricardo?
Yes, doctor.
Yes. And we have already started doing tests on you, and we have ran quite a bit about bit tests like some blood tests, and also to have a check about your kidney function. How is your kidney working? Some X-rays, I guess. So many of those have come out quite well, but there are some abnormalities in some tests. Would you like to know about it?
Yes, doctor.
Okay. There are some tests that we run to find out whether there is any inflammation or bug infection present inside. Okay. So some of these tests have come out to be a bit abnormal. Uh, are you getting me?
Yes, doctor.
Yes. These tests can get abnormal due to a good many reasons. Sometimes it can be bug infection. Sometimes it can be some type of inflammation. Even some cancer can also cause it. And at the same time, we have found that there are some tests in your liver. Have you heard about liver? What is liver?
Yes, doctor. It is in our tongue.
Yeah, yeah. It's an organ in our tummy, and it's a very important organ. And we ran some tests because of this, to find out whether your liver is running fine or not. And we have found that some tests of your liver are a bit abnormal as well. So we are thinking at this moment that there can be some problems with your liver, and we have already. Are you willing to know more about it now at this moment? Are you thinking that it's going a bit more for you to chew in one day?
Doctor, you are telling that they are they have find something abnormal. Why didn't they started in treatment?
Yes, yes.
Let me start
I
the
can
treatment.
complete.
I could feel better.
Yes, yes. I can get it. I can get it. And may I now explain something more about your condition?
Okay, doctor.
Yes. Actually, what I am telling is that this liver, the tests of your liver that we have done, that can be abnormal due to a good many reasons. Actually, um, like sometimes the liver itself can be the problem, or sometimes problem in other parts of the body can also cause problem to liver. Are you getting me?
Yes, doctor.
Yes. So we have already sent some other tests to find out whether your liver is affected or not. Are you getting me now, Mr.
Yes, doctor.
Ricardo? Yes. We tell it some specific bug infection like virus. Have you ever heard of it?
Heard the name virus. And do I have
Okay.
virus?
We have already sent the tests to find out whether there are virus involved or not. Okay. We have also taken sample from your blood to find out whether there is any infection in your blood or not. Are you with me, Mr. Ricardo?
Yes, doctor.
Yes. And you asked a very specific question. I can get it, that why we are not starting treatment. Am I right?
Yes, doctor.
Yes. Here is a very important thing that actually in these conditions like yours, where whatever treatment we start, uh, this might affect the result outcome if we do start the treatment before getting the result. Are you getting me, Mr. Ricardo?
Yes, doctor.
Yes. And at the same time, these treatments can be, if we do not diagnose it before, these treatment can at times rather harm you rather than improving you. Are you with me?
Okay, doctor.
Yes. Oh, yes, yes, Mr. Ricardo. Hello.
Yes, doctor.
Yeah, yeah. At this moment, do you have anything specific to know?
Yes, doctor. You didn't give me any medication, and I am having fever. I am having weakness, and I am suffering that with lot. I could have been kept at home. Why have you kept me here and doing nothing for me?
Yes, I am. I can understand um, your anger. Actually, what we are doing is actually uh, we are doing you for the best interest of your health. Because if we start any treatment by just doing some guesswork, it might be very, very harmful for you. Because any treatment at this stage can be very drastic, or it can be very aggressive treatment as well. So if we must be very, very sure about it before we start it. Are you getting me, Mr. Ricardo?
Cannot you just advise me some painkillers, some fever medication? I am suffering with a lot, doctor.
Yes. Okay. I can get it. Well, we will actually try to. I'm going to talk about it with our consultant as soon as possible. Whether we can give you some medication in the meantime to ease you a bit, but it might not. It wouldn't be the specific treatment that we are looking for, Mr. Ricardo. Are we getting it?
Yes, doctor.
Yes. At this moment, may I share you something more?
Okay, doctor.
Yes, yes. We have, as I have told you before, that we have already given you given some specific tests. Okay. Uh, and we actually also wish to run some more scanning tests on you as well to be more and more specific. Are you getting me, Mr. Ricardo?
Yes, doctor.
Yes, actually, after doing all these, I think we will be much more sure about your diagnosis, and it will be we will be in a far better position uh, to be sure about you and your condition. Are you with me, Mr. Ricardo?
Yes, doctor.
Okay. At this moment, do you have any more query to ask me?
Yes, doctor. I just want to know something.
Yes, of course. You can tell me.
Okay, doctor. I have one more question.
Yeah. Please, can you please tell me about
Cannot
it?
you do it on outpatient basis? I am the only earning member, and I work for a private company, and they will not give me any salary for this time. I will be at a great problem with that, doctor.
Okay. I will actually. That's a very valid point, and I can understand that you're a bit more problems. I will immediately talk with our hospital manager and also our consultant, and if you want, we can also involve the occupational health services in this matter to help you out more. Will that be okay or better for you,
Yes,
Mr.
doctor.
Ricardo? Yes. Well, at this moment, may I know that do you have any more concerns? Anything that you would like to know?
I just want to get relief of this, doctor, and whatever is possible, just do it as soon as possible because I cannot wait so long.
Yes. Actually, I can get it. And well, may I actually ask you some personal questions at this moment? That are you going on well with your? May I ask?
Okay, doctor.
Yeah. Are you going on well with your personal life, or do you think that you need any help emotionally? Or as you have told that there has been some problem with your job, there will be if we can't do it on an outpatient basis. Like if you like that, if you feel any problem in being emotionally or
Yes,
any
doctor.
other
I
way.
am suffering for a more than 1 month, and no diagnosis have been done yet, and I am really really worried. And sometimes it feels me distressed that I am going to die.
Yes, I can get it. I can get it. We are very sorry for your inconvenience, but it's actually very important to find out the disease. So we are trying our level best to find it out as soon as possible. And at the same time, still you are telling that you are feeling stressed out. We can understand it. But if you want, we may also arrange a meeting with a mood doctor if you like, so that you can ease up a little bit more.
2 minutes
Will
remaining.
that be good for you?
Okay, doctor. That will be fine.
That will be fine. Okay. And at this moment, do you want anything specific to know about again?
How long it may take, doctor? Do you have any idea?
Yeah, actually, at this moment, I'm not totally sure how long will it take, but considering your concerns, I will convey this with to our consultant, and they will try to map it out and do your tests as quickly as possible. Will it be okay for you?
Okay, doctor.
Yes. Any more questions?
Just one question, doctor. Can I visit home when being admitted hospital because my mother is sick and my wife cannot totally take care of my mother because we have 2 children and
Yes,
my
yes,
wife
yes.
has to take care of that.
Yes, I can get it. And if you want, I can actually uh, involve the social health services in this matter as well. So that, and I will all convey this to my consultant as well as immediately, so that uh, all of them can work it out together to map out a better plan for you. Will that be all right?
Okay, doctor.
Okay. Anything more to know?
No, doctor. Thank you.
Okay. Can you please go? Do you want any special anything, any transport to send you? Okay. Okay. That's all right. And do you anything more to know?
No, doctor. You have explained everything in very
Okay,
good way.
okay, okay. That's all right.
You have been kind enough, doctor. You are the first doctor who have talked with me about my condition.
Okay. Thanks a lot. And whenever you have any more query, please let us know. We will try our level best to help you out.
Okay,
Okay. Okay. So thank you, Mr. Ricardo. Thank you.
Okay, time up.
Okay.
So what was your task?
The task was to inform the patient that diagnosis is not confirmed and cannot be treated blindly.
And what was the scenario?
The scenario was that he admitted 3 days ago with malaise, fever, generalized body ache. Some tests were done, like kidney function tests and some other tests, autoimmune profiling. But they were actually normal. But some CRP and ESR was raised, and liver enzymes were slightly raised as well. Viral serology and culture reports were pending, and some planning of CT scan or PET scan were being planned. And he was wanting to get the treatment as soon as possible.
What do you think? Have you been able to relay the information, correct information?
I think I missed some points when I told that uh, these can be the causes like autoimmunity, infection, or inflammation. I should have told that we have already checked out some like defense system. I think they might not be involved. I think I should have cleared up that because autoimmune profiling was done, kidney function was done. So I think I should have ruled out that.
Okay, any critique on your performance? Dr. Haitham, do you want to add anything? Otherwise, I will.
Well, another thing that I was just destroying the whole discussion. Well, I was just accidentally I was asking him whether I would go travel, arrange for any travel for something like that. I just cut it down at that time, but it was a great great.
You did lot than this. You did lot more bad
Yeah,
than
yeah.
that. I'm talking with that. Before that,
Hmm.
is Dr. Haitham want to add anything?
Yeah, yeah, yeah.
No, so far, no, nothing.
Yeah, yeah.
Okay, so initially, patient while talking, while after you introduced yourself, patient started talking about his anger, his frustration. Okay,
Yeah, yeah.
and you have
Interrupted.
interrupted twice, not only once.
Okay,
This is the biggest crime.
okay,
Never interrupt patient,
okay.
because he was telling his frustration that no one has even talked with him, no one has even informed him that what is happening with him.
Yeah,
Okay,
yeah,
and patient have already raised 3 concerns within 1 minute of your starting the conversation, and you haven't met any of them.
okay.
Can you remember those?
No, not at this point, doctor.
Okay, he said that, okay, I have been admitted for a long time and no one even talked with me. You haven't given any explanation for that.
Yeah,
Why I am having this? You haven't gave any explanation at that point, though after asking later you have went for that.
hmm.
Also, he said that they have kept me admitted, but I am not getting any treatment. At that point, you haven't gave any um, answer for that, or you haven't assured that you are going to answer all his concern, or you are going to meet all his concern, and you can understand. And also within the discussion, you haven't been seem to be so much sympathetic. You could have asked, okay, I am extremely sorry that no one could talk with, no one have talked to you. Actually, we were busy, or there might be some interruption in the communication, but I will raise the concern
Yeah, yeah, yeah.
so that he can get assured that, okay, this will not happen to him in the future. Otherwise, he will think that okay, I have asked nurse so that the doctor came, and next time this is the procedure. Otherwise, they will not come. Okay.
Yeah, yeah.
So you should have told that. And another thing was yeah, interrupted, and you have kept me without giving any treatment for 3 days. Okay, you could have. I thought that you could give a good explanation for that. Okay, actually, uh, you are admitted here to your follow-up as you have these symptoms, and we have done this test already, but they came to normal, and we are here to always monitor you so that we can monitor your condition, and after, on that basis we can get a better idea. And, please don't think that we are not giving any attention to you. Actually, we are giving we follow the instruction to our nurses, and they are doing, and they are always keeping records of that, because nurses are routinely taking records of those that are ordered on the order sheet. Okay, so that patient could get idea that why he is admitted. You haven't told it at any point.
Yeah. Yeah.
Okay, and there was thing that you could have asked on your own, that I am suffering a lot, but no one paying attention to me. You haven't give any good answer for that. Actually, patient was having some symptoms like fever, body ache. You haven't prescribed any medication for that. At that point, at least you could have said that okay, I can understand. I am extremely sorry that you are suffering from the symptoms, and I will prescribe you some medication that can relieve you. And I will also raise this. I will also inform this to my consultant, and if you need any special medication, he will also prescribe that. At least you can prescribe paracetamol, some paracetamol, or some painkillers, because
Yeah.
he is having this problem for a long time. He told you that I am suffering from for more than 1 month.
But, well, I told that I'm going to talk with the consultant and
Okay,
see that.
you are talking. You are going to talk with the consultant that you are coming to give me medication, and already I knew that you come only after uh, asking the nurse, and otherwise when I will get the treatment, I do not know. You
Okay.
should have said, okay, I am extremely sorry that you are suffering this, and I will add some medication that can ease your symptoms. I am sorry that this happened to you. And is there any other specific symptom or any specific issue that is bothering you?
Okay.
Then I could raise, okay, there are some issues. I cannot eat. I cannot
Yeah.
eat foods here. I cannot sleep at night properly in this area. That is making me some worried.
Okay.
And there were also something that I already told. You have you have should have asked. You should have explained that why I am admitted here, and I already told you that I have some problem, and at least you should have asked that why is there any problem to be admitted here, or to remain admitted here. I voluntarily told you that okay, I have a problem. I have a problem with my mother. I have problem with my job, and after that you have raised the issue. You
Yeah.
are
Yeah.
not
Yeah.
you are not voluntarily going to, that is, discuss this condition. That means that you don't want to discuss this, or
Empathetic.
you don't want to know
Mm.
this. You just
I was not empathetic. Yeah.
you are just here to tell your explanation, and all that time you gave long sentences, and you just kept talking about what you want to tell. You didn't want to know my question, and even I have to ask few questions several times, and some questions have been even remain unanswered, because whenever a patient is asking a few questions within a para or within a sentence, then you should have all try to write down or try to memorize. This patient have asked so many questions this time.
Mm.
So at least try to task that, or again ask that you have asked me several questions. I have answered this, and I think you have also other frustration. Can you tell me little bit more about those? That means that you have that means you have forgotten, but you are showing that you haven't forgotten. You just want to know more.
Yeah. Actually, I have done several crimes, I think, in this case. However,
And the biggest crime was stopping the patient and starting your talk.
yes. Well, may I ask you one thing? That actually, frequently I forget to meet all the concerns. Is it wise to, at the beginning, when the patient says his words, to write it down those concerns for my own convenience? May I ask you? Because many a times we forget those.
Writing can bring somewhat that patient is thinking that you are writing a complaint, or that is making somewhat bad. That when you are talking with me, you are writing notes. That how will you feel it, or how will you take it? You will take it as a manner of disgrace or like that. So just try to memorize, or just try to note the key points. Okay, he asked this, he told this, and even if
Well, because this is the biggest issue. Because all the time I feel that.
when okay, this is not a issue. That when you have forgotten, okay, I can understand that you have raised a few concern, and I think I have made several of those, and you have more concern. Can you please tell me more details so that I can explain it to you?
Yeah.
This means that you have forgotten, but you
You
have
know, I know the one.
patient will think that okay, he wants to know more, and patient will think that the patient will not think that you have forgotten those.
Yes, I can get it. I get it. Yeah, that's right.
Okay, anyone want to add anything, or I will go for the next case?
Yeah. You, Dr. Haitham, would you want to add anything? Hello.
No. I am with you, but I'm opening the mic. It's okay, no, nothing to be added. But regarding if you want to avoid forgetting, you can answer directly after the concern. Not to postpone answer after some time. You can answer directly, so you will not forget.
Okay. So, Mural, are you going for the next case?
Yeah, just join again. Okay, I'm ending this session.
Yeah.
Join again, same link.
Yeah.